Weeks, people are certainly feeling the effects.
Yeah, a new study found that about 36% of people surveyed in the Chicago area felt hopeless about the future at least once in the last week, and more than a third reported feeling depressed. Well, Dr. Anand Parekh is one of the advisors for the Data Foundation, and he joins us live from Maryland to talk about these findings. Thank you so much, Doctor, for joining us. We appreciate it. Can you go over the overall feelings that Chicagoans are having versus people of the rest of the country?
Sure. You know, we talk a lot about testing and the importance of testing, so we're not flying blind with respect to the virus. And I think this survey is also as important, so we're not flying blind to really the human condition. And I think mental health is a really important point. So as you said, Chicagoans compared to the larger American public, about 40% of Chicagoans essentially are saying they feel anxiety, hopelessness, loneliness about one day a week. 20% actually 3 or more days a week. So I think it speaks to the importance of support and services, mental health as well as behavioral health services for the population. But it also, I think, speaks to the important point that social distancing, of course, is so important as a community mitigation measure here to fight the pandemic. But that must not equate social isolation. We still need to be connected to our family and our friends as well. So that these feelings are not elicited.
Well, some of the other questions you asked, Doctor, certainly would explain some of these things, and I'll get to one of them first, which was that 42% said it's not too likely or not likely at all that they would have a job in 30 days.
Yeah, it's a pretty astounding finding as well, and if you go beyond that, even 90 days, it's about 30% of individuals don't think that they'll have a job. Again, speaking to the economic insecurity here, and again, the importance of sound policies to really mitigate these economic consequences. So unemployment insurance, food assistance, housing assistance, small business support, all of these things to mitigate some of the feelings that Chicagoans are having.
Can we do anything to change these feelings? Because this is going to be like this for a little while yet.
Well, I think, you know, we are in this for the long haul. You know, it's not going to be a couple of months. It's going to be a year or two, really, until we have a vaccine or reach a point of herd immunity. So the new normal is going to be something that we're all going to get used to. I think so far, Chicagoans are doing pretty well. In the survey, we found that over 90% are washing their hands well. They are socially distancing, 6 feet separation. They're avoiding large crowds. They're wearing masks. But I think at the same time, these findings suggest that we need to support one another. We need to be socially connected, keep in touch with one another, and make sure that individuals also get the support and professional services they may need.
And another one of the troubling questions that came back was the 23% at some point in the last month ran out of food and had no money to buy more. I just want to put that out there. I don't want to dwell on it because I want people to shift who are going through this and understand, Doctor, as you pointed out, that you're not alone. It's important to know that there are a lot of people in this situation right now, and it's normal to not feel okay.
Absolutely. I think that's a really, really important point. You know, we're all in this together. Many of us never would have thought we would have been experiencing a pandemic in our lifetime, but it's here. We need to support one another. We need to listen to public health authorities, and we will get through this together.
Dr. Anand Parekh, thank you so much. Appreciate it.
Thank you, Doctor.
Thank you. Stay safe.